Dr. Harper, let's start off with what is GLP-1s and why is everyone raving about it?
Well, GLP-1 itself, it stands for glucagon-like peptide 1. And this is a hormone that naturally is already secreted by the gut after we eat. And what the hormone does is it signals to the brain that, Emily, you've been eating, you're getting full, and you can slow down. And then it actually helps to, which is a huge thing, it helps to control our blood sugar levels. And it does this through actually increasing our insulin levels, and not in the way that is going to keep our insulin levels chronically elevated, which is not good for us, but it helps to increase the levels specifically when our glucose, our blood sugar levels actually increase. And that is obviously going to be after we eat. So that's what GLP-1 is. It's a hormone that our bodies naturally make.
Okay.
Now, the reason that this GLP-1 is becoming such a big deal is because of the fact that, well, for the reasons that I just now stated, the appetite control and then the blood sugar regulation. So there's health benefits as far as helping us to lose weight and then helping us to keep our blood sugars more regulated, along with many other things, which we'll get into that.
Okay. So now that we know what GLP-1s are, what is the difference between semaglutide and tirzepatide? I keep hearing about it.
So semaglutide is a GLP-1 receptor agonist. What that simply means is that it pretty much is mimicking the activity of the GLP-1 hormone that our bodies already secrete after we eat.
Okay.
Now, tirzepatide has a dual action, basically.
Okay.
And what that means is that it mimics the activity of GLP-1 and GIP. That's where that dual activity comes in. GIP works similarly to GLP-1 in the sense that it also helps to control blood sugar levels, because it, again, helps to increase insulin levels. And this only happens, this increase in insulin, when our glucose levels are already elevated, which is, again, typically after we eat. So that is the difference between semaglutide and tirzepatide. It's just that tirzepatide mimics another one of the incretin hormones,
which is GIP.
GIP, correct. And then we have dual action. And the difference between the two further is that tirzepatide has been found to be more effective for blood sugar control and for weight loss as well, because of that dual action with the GIP added on.
So you would say one is better than the other?
So based on research, yes, one has been found to be more effective because of that dual activity. Because when you have GLP-1 and a GIP together, they work synergistically, and that makes the GLP-1 GIP dual action more effective than the GLP-1 on its own.
So since it is a medication, is there a certain time frame people should stay on this medication, or?
So one thing to keep in mind is that these medications are meant for long-term use, or you can be on them for a long period of time.
And it's safe.
Yeah, and it's safe as long as you're being well monitored, all of that. So as far as how long someone is going to be on them, for one, it's going to depend on weight loss goals. And then, of course, even once you reach the weight loss goal, that does not mean that you have to stop taking the medication, because plenty of patients are on the medication still for a longer period of time to help them maintain.
For health reasons.
Yeah, for health reasons, potentially, and to help them maintain, the weight loss that they have achieved. And another thing is that's big for me, because I have clients all the time ask, well, how long do I have to be on it? There's not a timeline of how long you have to be on it necessarily. A big thing as far as clients that are taking semaglutide or tirzepatide for weight loss is that you want to give yourself enough of a chance for re-evaluating and resetting lifestyle habits that may be contributing to obesity.
Yes.
So I always tell clients, often maybe like 8 months or so, 8 to 12 months, because I feel like that gives a good enough time period for a patient to really hone their lifestyle habits. Because again, I'm very much not into the term dieting. I don't want anyone dieting, because that's typically not sustainable and it's just not fun.
Not healthy.
So we're looking to key in on our lifestyle habits, get those things in order. get to our goals as far as weight loss, and, you know, healthy lifestyle.
Yeah.
And so that's really patient dependent, honestly. But it's just important to keep in mind that, yes, you can be on the medications for a long term. So there's not necessarily like a timeline of how long you can be on it.
So do you think there's any misleading information about GLP-1s on the internet, or any myths, anything like that?
Well, a lot of people, I do feel like, think that GLP-1 medications or GLP-1 GIP medications are like a magic shot, and that you don't have to necessarily do anything to assist yourself along the way. You know, I have clients that come in and I literally have had someone tell me, I don't want to sweat. And I'm, you know, at that point, I'm like, well, you might as well not really do this. Because, yeah, and, you know, the thing is that while these medications do work very well, yes, they do. For most people, yes, you will experience, you know, weight loss,
The purpose
health
of
improvement.
effective as well. But
Yeah, but you know, you want to make sure that you are putting an effort as well,
Yes.
because again, you want to be able to sustain the weight that you lose, hopefully, at least, you know, for the most part, and have your lifestyle in order. So while, yes, it does work very well typically for people to lose weight, even if you may not be putting in, you know, as much effort on your end,
Yes.
it's important to, because you really do need to be strength training for one. You have to exercise. Yes, of course, cardio is important for the heart muscle, cardiovascular health, but you do want to make sure that you are also exercising too, because
Active.
yeah, you
Fit.
want to be active, for sustaining weight loss, but also while you're on the medication, it's going to optimize your results for one, and also help you to achieve like more so of like the fit look that we really want, or that most people are looking for. So strength training, very important, because you do run the risk of having some muscle loss with these medications. If you are not taking an adequate protein, if you are not strength train, if you're not doing that regularly, you do run the risk of losing some muscle mass. And, you know, we want to be fit. We want to look fit. So that is a myth. Like, it's a magic shot that is going to solve all the problems. No, it should be a tool in your back pocket that you're using to get where you want to be on your health journey.
So because there are so many GLP programs out there, what would you say makes the one at NXTGEN different?
Well, with my patients here, it's just really important for me to keep track of you. I think it's really valuable to have 2-week or 4-week check-ins to see where you are. One thing I want to always check in on is, how is exercise going? And then, of course, like the other part of it, are you tolerating the medication well? I want to check in with you. I want to see along the way how you are doing. And I do this every single month, if not more often, because I want to make sure that we are looking at different nutrition factors that we can maybe tweak to help improve your outcomes. And then I just want to make sure that you are doing well along the way. And is there anything that we can change to make it better, to optimize your results?
Well, this is it. This was NXTGEN Talks for you. We hope you guys enjoyed. If you guys are thinking about starting or on the fence about anything, hit us up, and NXTGEN is the move. We'll see you guys later.